In August 2023, former neonatal nurse Lucy Letby was convicted at Manchester Crown Court on 7 counts of murder and 7 counts of attempted murder concerning patients under her care. A year later, she was subsequently convicted on a further count of attempted murder in relation to a case on the original indictment. She remains the UK's most prolific child serial killer in modern British history. However, recently a press conference took place in London, arranged pro bono by the PR agency Maltin and attended by the MP David Davis, Mark MacDonald as well as others, and Dr. Shoo Lee, who presented the press conference with his new findings in relation to Lucy Letby's convictions, claiming they found no evidence of murder or attempted murder. What also appeared after the press conference was a report written by a panel of 14 experts, again in relation to some of the babies in this case. Now, this video seeks to explore what was actually withheld from the public during this press conference in relation to Lucy Letby's original trial. This has been made possible by the purchasing of court transcripts concerning Lucy Letby's original trial. So let's start at the beginning with the first child on this indictment, Baby A, also referred to as Baby 1 during the press conference, and Dr. Shoo Lee's new explanation as to why Baby A may have died. Take a listen to the following.
So we're going to give you the highlights of what happened, talk about what the allegations were in the conviction, and what did the panel find. So Baby 1 was a case of air embolism. This was a preterm baby, twin 2 infant, who was born by emergency cesarean section. And he was well until the 2nd day of life, when he suddenly collapsed and had skin discoloration with blotchy patches of brighter pink on a bluey-grey background. And he did not respond to resuscitation. The allegation was that Baby 1 died from injection of air into the intravenous line, causing air embolism and resulting in collapse, patchy discoloration of the skin, and eventually death. So, to begin, I will give you a little bit of background on the publications of air embolism. The prosecution, in part, based their allegation on a paper that I had written in 1989, where I described all 57 cases that had been published to that point in time. And it showed that the babies would present with a certain number of symptoms or signs, and also that about 10% of them had skin discolorations of different kinds. At that time, I did not distinguish between arterial and venous air embolism. And in this particular case, the allegation is that she injected air into the venous system, into the veins. So there's a difference between arterial and venous, because the arteries carry blood to the body to supply the organs and the skin, whereas the veins actually carry blood away from the organs or the skin to the heart and to the lungs. And in the new paper that I had published in December of 2024 in the American Journal of Perinatology, a copy of which will be in the summary report that you will receive, we actually separated the cases with arterial venous air embolism from the cases with venous air embolism. And what we found was that in the cases where air was injected into the veins, there were no cases of patchy skin discolorations ever described in the literature. So the notion that these babies can be diagnosed with air embolism because they collapsed and had these skin discolorations has no evidence in fact. All right? None of this actually has ever been described. If this is true, it would be the first case ever described, but it's never been. And there's a reason for that. The reason is that in the arterial system, when you inject air into the arterial system, it goes directly to the skin or the blood vessels or to the organs. Whereas in the venous system, it has to go to the lungs first. And the lungs has a complex bed of very small blood vessels that filters out all the air bubbles if they come through, so that they don't actually get to the arterial system. Now, in newborn babies, there's a hole called the foramen ovale in the heart, which can allow the blood to actually move over to the arterial system. But it has to go against pressure, because the pressure in the arterial system is higher than in the venous. And so what we found in the literature was that there were no cases that have been described where, in fact, these skin rashes have occurred. So let's do away with that theory. All right? The notion that these cases are air embolism because they collapsed and because there were skin rashes has no basis in evidence. Okay, let's be very clear about that. Now, so what can be the possible causes then? Why did this baby suddenly collapse? So we went into the history of this baby to see what actually happened. So in this baby, the mother had antiphospholipid syndrome, which is a condition in which the immune system mistakenly creates antibodies to attack tissues in the own body. Now, these antibodies can trigger blood clots to form in arteries and veins. And during pregnancy, these antibodies can pass through the placenta to the neonate and lead to thromboembolism, which means clotting in the baby. Particularly happens if there is concurrent infection. Now, post-mortem of baby 1 showed that there was a recent non-occluding thrombus in the liver, which means that in fact there was a thrombotic event that happened in this baby after the baby was born. On the day of the collapse, the baby's IV tissued at 1600 hours. Tissued meaning that the IV that was supposed to be in the vein somehow penetrated the vein and came out into the tissues. And so the infusion was not going into the circulation, was going into the tissues. And so the area was getting swollen because the infusion was coming out. And so because of this, they removed the IV and replaced it with an umbilical venous catheter. But the first insertion was malpositioned, and so they had to replace it again. Later on, a long peripheral line was then inserted at about 1900 hours. Now, they then took an X-ray, etc., to make sure it was in the right position, and eventually the infusion was restarted. But infusion was restarted at 2000 hours. So there was a period of up to 4 hours when these lines were in, but there was no infusion. Now, here's the problem. Even in a baby without any problems, we avoid putting lines in without infusion. Because if you do that, clots can form on these lines. In this case, the baby actually predisposes to clot formation because of the antiphospholipid syndrome. And therefore, to have lines in there for 4 hours without infusion is a risk. All right? Now, what then happened was that minutes after the infusion was restarted at 2000 hours, baby 1 collapsed. It is most likely that there was a thrombus that formed on the tip of the catheter that then dislodged when the infusion was started, and it migrated to an artery supplying the brainstem, causing sudden collapse and inability to resuscitate the infant. It is also possible that baby 1 had placental fetal vascular malperfusion. So what's that? That's a condition in which the fetal villi in the placenta present small thrombi that can travel to and occlude small blood vessels in major organs like the heart, brain, and liver. And if a small thrombi lands in an artery supplying a critical structure like the brainstem, it can also cause sudden death, and they are very hard to find on post-mortem because these vessels supplying these critical areas of the brain or the heart are very tiny. And so all you need is a small thrombus to occlude it. When you're doing a post-mortem, you're doing cuts to see whether you see anything. And you have to actually cut exactly where that thrombus is in order to identify it. So just because a post-mortem doesn't identify it doesn't mean it isn't there, right? And in the second condition, which is fetal vascular malperfusion, these collapses can occur 1 to 2 days after birth. So one of these 2 causes probably caused it, and we think it's the first one because of the temporal relationship with the lines that were inserted, the predisposition to formation of clots on these lines if you don't infuse it, and then the occurrence of the collapse just minutes after the line was infused. So our conclusion is that baby 1 died from thrombosis and that there was no evidence of air embolism. Because in this baby, the allegation for air embolism was that number 1, the baby died, we could not find a reason for it. Number 2, this baby had this collapse accompanied by these skin discolorations, which was consistent, which is what the allegation was, with air embolism. And what we are saying is, first of all, the second reason doesn't hold, because air embolism by the venous system does not produce these kinds of skin discolorations. Number 2, there is a plausible and reasonable reason why this happened, which is what I just explained. So for both those reasons, we feel that this diagnosis is wrong, that this is not pulmonary air embolism. In fact, this is because of thrombosis.
So now let's take a look at the expert panel. Now, Dr. Shoo has assembled 14 experts from around the world, and this is from that specific report, the report for baby A. Take a listen to the following. The mother had antiphospholipid syndrome, which is a condition in which the immune system mistakenly creates antibodies that attack tissues in the body. These antibodies can trigger blood clots to form in arteries and veins. During pregnancy, antibodies can pass through the placenta to the neonate and lead to thromboembolism, particularly if there is concurrent infection. Post-mortem of baby 1 showed a recent non-occluding thrombus in the liver, which means there was a recent thrombotic event. On the day of collapse, baby 1 had 2 central catheters that were left without infusion for up to 4 hours, which predisposed to thrombosis when there is no infusion. Shortly after infusion was started in the most central line, baby 1 collapsed. A thrombus from the catheter tip likely migrated to an artery supplying the brainstem, causing sudden collapse and inability to resuscitate the infant. It is also possible that baby 1 had placental fetal vascular malperfusion, in which the fetal villi in the placenta present small thrombi that can travel to and occlude small blood vessels in major organs like the heart, brain and liver. If a small thrombus lands in the artery supplying a critical structure like the brainstem, it can cause sudden death, and they are very hard to find on post-mortem. Collapse associated with fetal vascular malperfusion can occur 1 to 2 days after birth.
Why did this baby suddenly collapse? So we went into the history of this baby to see what actually happened. So in this baby, the mother had antiphospholipid syndrome, which is a condition in which the immune system mistakenly creates antibodies to attack tissues in the own body. Now, these antibodies can trigger blood clots to form in arteries and veins. And during pregnancy, these antibodies can pass through the placenta to the neonate and lead to thromboembolism, which means clotting in the baby.
So what's being stated here by Dr. Shoo, and in particular during the press conference, is that this child died from a blood clot. Just trying to put it in the simplest terms as possible. This child died due to a blood clot. Now, the reason that this child developed a blood clot in the first place is a combination of the care that was given to this child, but also, and critically, most importantly, the fact that the mother had antiphospholipid syndrome. And that's the reason that this child was much more susceptible to getting a blood clot in the first place. Let's just read that again. The mother had antiphospholipid syndrome, which is a condition in which the immune system mistakenly creates antibodies. Remember this word, ladies and gentlemen, antibodies that attack tissues in the body. These antibodies can trigger blood clots to form in arteries and veins. During pregnancy, antibodies can pass through the placenta to the neonate and lead to thromboembolism, particularly if there is concurrent infection. Now, what he hasn't told you, and the reason for the delay in my video today, is because I was waiting to receive the transcript from November 29th, 2022, and the evidence given in court by Professor Sally Kinsey. Now, let's just give you a little bit of a background into Professor Sally Kinsey. Now, Professor Sally Kinsey is a retired paediatric haematologist, a fellow of the Royal College of Physicians, the Royal College of Pathologists, and also an honorary member of the Royal College of Paediatrics and Child Health. She was a professor of haematology at Leeds University from 2007 and retired from everyday practice roughly 18 months or so before Lucy Letby's trial took place. Professor Sally Kinsey gave evidence to the court on day 40 of Lucy Letby's trial. It was there that she gave expert evidence concerning the cases of child A and child B, and also regarding the case of child E. So let's take a look at what was established when Professor Sally Kinsey gave evidence. Okay, so if anyone wishes to validate what I'm about to share with you, this is day 40 of Lucy Letby's original trial, the 29th of the 11th, 2022, and again reading from the official court transcript. The following is Professor Sally Kinsey's evidence in chief, where she's asked questions by the prosecuting barrister, Nicholas Johnson, KC. I'm going to move on now, please, Professor, to your Section 4 of your report. Within the medical records relating to Child A, did you find the results of a full blood count test taken that had been undertaken on the 6th of July at just after 10 p.m? She replied, yes, I did. Just to put that into context for the jury, that's about an hour and 3/4 after he'd been born. She replies, yes. Others can ask you if it's thought to be necessary, but putting it in a sentence, was Child A's full blood count normal or abnormal? She replied, it was normal of a child of his gestational age, yes. Thank you. The jury will recall from the evidence that a cause for concern in relation to both Child A and Child B was the maternal antiphospholipid syndrome from which the mother of Child A and B suffered. She replied, yes. Professor Sally Kinsey then goes on to discuss in great detail what antiphospholipid syndrome is, and then is asked the following question. Did the antiphospholipid syndrome pass to either Child A or to Child B? She replied, no, that is not the case. I can explain that in a little bit more detail, because if one looked at the blood results, it would show that there were antiphospholipid antibodies in the circulation of the babies. The presiding judge, Mr. Justice Goss, then says, obviously it's very helpful of you to offer to do it, but the important thing is that neither Child A or Child B had this condition. She replied, that is correct. Yes, it is. Anyway, if you need, you can explain how you can tell that. But it's basically from the blood that's taken. You'd find the antibodies in the blood. She replied, you would find the antibodies in the blood. One type, only the IgG, which is not significant in the children. Again, talking about the twins, Child A and Child B. Mr. Johnson. All right, we know from the evidence that we heard that the treating doctors at the time were concerned about this and were not sure that it hadn't passed. But you can say it didn't pass from mother to children. She replied, no, it didn't. Now, interestingly, this opinion of the expert here, and bearing in mind we're looking at a blood expert, a bona fide haematologist, this opinion appears to have been accepted not just by Lucy Letby herself, but also by her barrister Benjamin Myers KC, and also, you would imagine, Lucy Letby's experts from her original trial. Take a listen to the following. This is the cross-examination of Professor Sally Kinsey by Benjamin Myers KC. In that report, you go through the background relating to Child A, as you have done in your evidence today. And at the end of the report, you can see at the bottom of page 7, you set out your summary and opinion, which goes over the page, in fact. She replied, yes. And your summary and opinion is focused on the question of whether or not there is any hematological abnormality, or whether maternal antiphospholipid syndrome played a part in what happened to Child A. She replied, yes. And your conclusion in summary and opinion is that they didn't. She replied, yes. He responds, I am not disputing that. I am not disputing that. Now, to your average member of the viewing public, this press conference would come across as incredibly compelling, particularly when Dr. Shoo discusses air embolism. Now, during the press conference itself, Dr. Shoo asserts that there is absolutely no evidence of venous air embolism. And this is due to the fact that any air injected into a child would need to pass through the lungs, where any air bubbles would be subsequently filtered out. However, what Dr. Shoo doesn't tell you, doesn't tell the press conference or the wider public at large, is the fact that Child A died with a patent foramen ovale, also known as a PFO. Take a listen to the following.
A foramen ovale is a small hole between the two upper chambers of the heart called the atria. It's a small slit-like defect that occurs in utero in normal fetal cardiovascular development. And it allows for oxygenated blood to bypass the fetal lungs. Upon birth, after the first breath or so, that slit-like opening closes, except it persists and it does not close in about 25% of individuals, typical healthy adults. When it doesn't close, that hole, which we call foramen ovale, is then called a patent foramen ovale or an open foramen ovale. And in the vast majority of patients, 99.5% of individuals, that defect, the PFO, patent foramen ovale, has no clinical consequence, implication. It doesn't require study, surveillance, or management.
So in simple terms, this basically means that there is a small slit or opening in the heart. Now, this allows blood to travel between the right and left atrium, avoiding the lungs. Therefore, any air injected into a vein in a baby with a PFO would cause the symptoms this child experienced. Now, we know that child A was born with, and as I say, most importantly, died with a PFO, an open foramen ovale, a patent foramen ovale. And this was discussed extensively during Professor Sally Kinsey's evidence. Now, I'm not going to go through the transcript in its entirety, but I will cover this in its entirety during a future live stream. But it's very, very clear, very, very evident, as I say, and important to remember that child A was born with and also died with a patent foramen ovale. And this is the importance of complete information. Dr. Lee's press conference assertion about air embolism failed to include crucial medical context. Child A's patent foramen ovale, also known, as I say, as a PFO, was a critical detail not mentioned during the press conference. The presence of PFO creates a direct pathway that could allow air embolism to occur, contrary to the initial assertion. The omission of child A's PFO in Dr. Shoo Lee's press conference significantly alters the interpretation of the possibility of venous air embolism in this case. Now, this also makes me question good old Dickie Davis, good old David Davis, who by all accounts during this press conference claimed that he's read every single page of Lucy Letby's trial transcripts, including the evidence. So it makes me wonder why David Davis hasn't said this publicly. Why has David Davis not come out and said, well, hang on a minute, Dr. Shoo Lee, you can't be right about this antiphospholipid syndrome because the child actually tested negative for antiphospholipid syndrome due to there being no antibodies in the blood test. Oh, actually, Dr. Shoo Lee, your assertion about venous air embolism and it being actually impossible isn't quite right because this child had a PFO. I wonder why he hasn't told anyone about that. Has he actually read these transcripts? I mean, not being funny, with the greatest of respect, I'm just a meager YouTuber. But I mean, it's very evident when you read the actual evidence from this case and the trial transcripts that all of this stuff was dealt with during the original trial. Now, the Court of Appeal will simply laugh this out of the courtroom. If they try and put this forward as the real reason that child A died, it just simply won't wash, will it? I mean, this has been accepted by Lucy Letby's defence, particularly the point regarding the antiphospholipid syndrome. Now, it's also worth bearing in mind that this panel were tasked to find a different cause. They were tasked specifically to find something other than deliberate harm. And if the best that they can come up with is antiphospholipid syndrome and a blood clot, and the fact that, well, really, air embolism wouldn't even be a possibility here, but failing to actually mention the PFO, I mean, if that's the best they can come up with as the most likely alternative other than deliberate harm, it really tells you quite a lot, doesn't it, about the defence case here. Finally, moving on to something else that wasn't discussed during this press conference in any way, shape or form in relation to child A. The expert testimony of Dr. Owen Arthurs. Now, I've just purchased 500 pages of Dr. Owen Arthurs' evidence in court. Again, this will most likely be covered during a future live stream. Dr. Owen Arthurs, a consultant paediatric radiologist at Great Ormond Street Hospital. He provided expert testimony on radiological findings in 2 infant cases regarding the trial of Lucy Letby, one of those being the case of child A. He reviewed X-rays and CT scans to assess the presence of gas in blood vessels after death. Now, as I say, I'm not going to go through the entirety of the 500 pages of evidence given by Dr. Owen Arthurs. I may well cover that in its entirety during a future live stream. But a few takeaways from the evidence given in court by Dr. Owen Arthurs was the following. And again, none of this was mentioned, none of this was referred to in either the press conference or the expert panel's review by Dr. Shoo and co. So, Dr. Owen Arthurs' findings. There was an unusual gas pattern which showed on the post-mortem x-ray. Now, this showed an unusual line of gas in front of the spine. And according to Dr. Owen Arthurs, this is not typically seen in natural deaths. So then they looked at the possible explanations. Number one was severe trauma, such as road traffic accidents. Well, child A was born and died in hospital, so that was ruled out. Overwhelming infections such as sepsis, that was also ruled out. Or air introduced through medical equipment. Now, obviously, that's the prosecution's case. And in his expert opinion, he said the x-ray was consistent with air being administered, but not definitively diagnostic of an air embolus. So what exactly does that mean? Dr. Owen Arthurs is basically saying you can't look at an x-ray and say, well, okay, this is because this child has had air introduced through medical equipment. You need to look at the full context, the full clinical context of the child in question. So in short, what Dr. Owen Arthurs is saying here is that you simply cannot diagnose an air embolus through the use of an X-ray image alone. But the prosecution didn't do that, did they? They also relied on the sudden and unexplained collapse of this child. The fact that Lucy Letby was stood by this child with access to this child's line shortly before this child collapsed. Also, the fact that this child then displayed an odd discoloration that many medical professionals working at the Countess of Chester Hospital had never seen in their career before. Combined with the post-mortem x-ray which showed an unusual line of gas in front of the spine, something not mentioned whatsoever during Lucy Letby's press conference or in the subsequent panel of experts report. Now, the purpose of this particular video isn't to provide an answer to each and every question raised during the press conference conducted by Dr. Shoo. It's about breaking down each case specifically. And most importantly, making the public aware of what isn't told during this press conference, what the public aren't aware of concerning the evidence presented during Lucy Letby's original trial. Do let me know some of your own thoughts down in the comment section below.